Pain is a common symptom in patients with cancer. It can occur at any stage of the disease. It's often present at diagnosis, and indeed it's often the reason why the cancer is diagnosed. So maybe 40%, 50% of patients will have pain at presentation, although that figure varies according to the type of cancer. It's also very common while patients are still having treatment, and that's sometimes due to the cancer, sometimes due to the cancer treatment. And in patients with advanced cancer, up to 80% of patients can have cancer pain. Despite the fact that it's common, it's often very manageable. So patients don't tend to or don't need to suffer with pain. So pain can have a huge impact on patients. Apart from being unpleasant, untreated, uncontrolled pain can have a number of complications, physical complications. Often patients with pain are relatively immobile, and that can lead to other problems. Pain can interfere with things like sleep and can affect people's mood. So it can have a huge range of complications. Equally, patients with pain often need to visit their doctors more often, the hospitals more often. It means their carers often have to do more for them. It means they may not be able to work. So it has huge implications at every sort of level of the patient's living. So it's important that it is managed properly, because all of these complications potentially are preventable. So there is an association between pain and psychological problems, and particularly anxiety and depression. The issue as well is that patients who do have depression find it more difficult to self-manage their pain. So there's almost a vicious cycle there. So good management of pain can help to prevent the development of these problems, as it can help to prevent the development of other complications. And often we use similar treatments to treat depression to treat pain. So we know that there is the involvement of the sort of higher centers within the brain are very important for the processing of pain, even in those patients who aren't depressed. It's important to monitor people's psychological state as well as monitor their pain.